Hi, I'm Dr. Ed Jacobs, and this is Dr. Tori Stone. And we're going to be doing a demonstration of impact therapy, which is an active, multisensory, creative approach to counseling, also very theory-driven. We're doing a role play, which Tori really doesn't know exactly what I'm going to do, but she'll see. The point of this role play is you'll see her making the counseling very interesting and using creative techniques. Not sure what she'll use, and then at the very end we'll make a little comment about it. So I'm going to be a 15-year-old boy.
Okay.
Mother wanted me to come and talk to you because I get in all these fights with her about schoolwork. She wants me to do schoolwork, and I don't like history, and I don't like English. I speak English, so I don't see why I have to take those courses. And she's saying it's important, and she says she wants me to go to college. And boy, we got into it, and I yell and call her names. And
Okay. Well, I'm glad that you came. I'm glad your mom sent you here. Are you here because she made you come here, or would you like it to be better with your mom too?
well, she cried last night. I don't like seeing her cry because it's just me and her, because my dad died about 4 years ago, and I think she still misses him.
Okay.
And she says, if your dad was here, you wouldn't act that way. But I don't want her to cry.
Okay.
But I don't want her bossing me around. I'm 15.
Gotcha. Is it fair to say you'd like to stop fighting with your mom? Is that fair to a goal for you?
Oh, yeah.
You'd like to. Okay. Can we start there?
Yeah.
I'm going to show you something. It's kind of like a radio station. Okay. It's called WDEP, and each one of those letters stands for something. So the W stands for wants, what you want, okay? So if we ask for what do you want to have a better relationship with your mom, get your mom off your butt.
Okay.
Does that
Both,
sound
yeah,
good?
Yeah,
okay.
yeah.
So I'll say counselor words, better relationship with mom, right?
Okay.
So better. And you would say, get mom off my back, right?
Right.
And they're kind of the same, right? Because if you had a better relationship with your mom. You mentioned some
And the
things.
W stands for what?
Wants. And that's
Okay.
I'll write that down. So what do you want? You want to have a better relationship with your mom, or to get mom to get off your back. And that's something I can help you with, okay? So I am glad that you're here today. You talked about things that you argue about. So we'll call them fight items. Okay, so this is stuff you fight about. One of the things that you said was grades. Is there anything else, or is that the main thing that she's kind of on your butt about?
That's probably the main thing.
Well, that's fantastic. Okay, so what do your grades look like?
C's. Yeah, mostly C's. I get a B in phys ed because I like it.
Okay, so if you try, you do okay.
Yeah.
On a scale of 1 to 10, 10 being trying really hard and 1 being not trying at all, what level of effort would you say you're giving in your academic classes? Math, science, language arts, social studies.
10 is trying a lot.
10 is trying real hard.
3.
Okay, so right now you're trying at a 3. Okay, and I told you this was WDEP. Wants, doing. This is evaluate and plan. And we'll talk about each one of these. What you're currently doing is trying at a 3, which is pretty low, right? So I'm going to put low.
She gets really mad when I don't turn in homework.
Okay.
Sometimes I do it and don't turn it in.
Okay.
Why is that?
That makes moms crazy.
Yeah.
If I had to answer that question, I would write a book and be on Oprah, because a lot of kids do that. You're not the only one. So right now you're trying at a 3 on schoolwork. Here's the money question. Evaluate. Here's my question for you. How's that working out for you? How is doing a 3 in terms of effort on your work doing it, getting your mom off your butt about grades?
Oh, it's not.
It's not working, right? Not working. Well, if your want, Okay, think about, you could think of your want as your goal too. Sometimes kids understand that a little better. If you think of your goal or your want to get your mom off your butt about your grades, and this is the main thing you're fighting about. I asked you how many things, and you gave number one, and not only number one, only to be grades. You want this to get better, but your effort is a 3. We've just established that this is not working to get rid of that. What we need is a new P or a new plan.
Okay, the other thing I do is I talk back to her,
Okay.
call her names.
About school.
Yeah.
So the crux of the fighting is about grades, but then you all play dirty. And we can talk a lot about why you fight the way you fight, and I can teach you some things about that. But what we need is a new plan to help you get along better with your mom.
And you can help me with that?
Absolutely, I can help you with that.
Okay, we'll stop.
Okay.
No, keep it going. Let me talk a little bit about what Tori did in probably 3 or 4 minutes. Because she's theory driven, and this technique, WDEP, you can go to YouTube or Google the term, and it's Dr. Robert Wubbolding created this concept, and you can read about it. It comes from reality therapy. But here's why we call this an impact therapy approach. She moved pretty quickly, and then she had a contract in her mind of what to do. It was theory driven. This WDEP is a technique out of reality therapy. She used the whiteboard to make it visual. We believe that you talk to the client's eyes as well as their ears. She did that. And also notice her voice and face and enthusiasm. I would encourage you to go back and watch it again to see all that. And then she used that rating. She used the number rating. We believe that impact therapy makes counseling a very visual and very concrete. Tori, you want to add?
Absolutely. I am a school counselor. This is something that I do 100 times a year because frequently adolescents have trouble with their parents around grades or other issues. I think it's empowering for the client to recognize their role in interpersonal conflicts. So from this, I would frame the issue, and then I would get into more personality kinds of things, also using theory. I think a really important distinction to make about impact therapy is that we're not telling you to move quickly. We're telling you to move as quickly as the client can move, and we're always thinking theoretically. When Ed started telling me this story, in my mind it framed up really quickly 2 ways, WDEP and transactional analysis. So I probably would use a blend, if I had 20 minutes with Ed, of WDEP reality therapy and then transactional analysis.
Pull up the small, yeah.
And
you would have used the small chair.
I would have showed Ed how sometimes he goes to his hurt child ego state and his mom gets in a critical parent about grades. This is a technique that I've taught, or a theory that I've taught to my own children who are very small, up through people in their 80s and 90s. It's a pretty simple theoretical construct for people to understand, but very powerful for us to understand that we're in charge of our behavior.
Yeah, for more information about impact therapy, go to my webpage, impacttherapy.com. Thanks.